All right, guys, in this lesson, we're going to talk about placing IVs in patients with dark skin tones. Now, these patients can sometimes be a challenge because veins are sometimes difficult to see. This creates a problem in that you're really just going, uh, it kind of diminishes your confidence a little bit because if you can see a vein and you can feel a vein, you you feel like you're all in, right? But if the veins are difficult to see, it makes it a challenge. You don't really know where to start. So use a little bit of experience, and use that your nursing instinct and your training to know where all of that anatomy is. Now, there are a couple of important things I want you to think about. You can actually use an alcohol swab. And if you think that you know where a vein is, cephalic veins are great, basilic veins are great. What you can use is an alcohol swab, and it actually creates a little bit of contrast in the light so that you can actually see. Apply your tourniquet just a little bit about like 10 to 12 centimeters as standard above the place you think you're going to go, and then use an alcohol swipe and rub it pretty aggressively. It does a couple of things. Number one, it creates a little bit of contrast with the light glistening off the skin. The other thing it does is that agitation releases histamines locally and allows that vessel to distend just a little bit. So that will actually help you. Another thing you can use is this blood pressure cuff. For patients that are typically a little bit more difficult to see because of darker skin tones, you can actually apply a blood pressure cuff. Apply it just a little bit above instead of just using a tourniquet. A tourniquet may not be enough. So you can actually use a blood pressure cuff to get this. Now, one other little trick that I want to tell you about is using the end of the cap of an IV catheter or even a pen. And what that does is it allows you to mark a spot. Let's say you find it, you go through all this work and you finally find a vein, but you're afraid that you're going to lose it. What you can do is you can actually use this trick, and I'll show you the way it works. What you can do is you take the end of this as an IV catheter. You can either use the cap here or you can use the end. But what you do is you find your patient's vein. Here's the vein right here. What's going to happen is you just take it and you push it over where your insertion site is going to be and twist it back and forth a little bit. And what it's going to do is it's going to create this impression in the skin where you can actually see where you're going to place that IV catheter, so that whenever you do use it or whenever you do scrub it with your antiseptic, that you don't lose your spot. So IV insertion should be the same way every time. You want to go through that routine. That routine is so very important. Just like those NBA players at the free throw line. Maybe it's 2 dribbles, maybe it's 3 dribbles, maybe it's you close your eyes like Michael Jordan did. But what you want to do is you want that routine. Now, prep your supplies. Get all the supplies you need. Know what vein you're going to go for. This can be done in an assessment. These first two things kind of go hand in hand. So look at your assessment. Okay, hey, I need a vein and about know where I'm going. Again, when you're to the point where you're practicing on your own, you're going to have to start multitasking. So, hey, I'm talking to my patient. I'm looking at their veins. Hey, this is where I need to place it. Okay, cool. I'm going to go grab your supplies real quick so I can get your IV catheter placed. I'm going to go grab everything I need, and then I'm going to get everything set up. That's so important because that allows you to have everything in place where you need to. Apply your tourniquet. And this is where the step number 3, this is going to be your big step. That's going to really help you to employ those tips and tricks we talked about. So use that alcohol swab, or if you need to, you can use that blood pressure cuff to get that those veins to distend a little bit, so you can actually see where you're going and to give yourself a better mark. And then use that little pin cap that I showed you, and mark that impression of where you're going to go. Then swab it just like you would, place that IV. Once you're in, then secure it. And you want to make sure that you use that primed extension set. That way, everything is all ready to go. Now, depending on your patient history, hands can sometimes be a great spot. If your patients are older or they're bariatric patients, they may not be ideal because of either excessive tissue or decreased skin integrity, but hands can be a great location sometimes. And one of the things you need to look at, or one of the things you need to remember, is that they can be painful. And the other thing is you are presented with several challenges, in that not all the veins are always awesome to work with. And this is an example of that. Sometimes you get a lot of branching veins. They're not straight. There's a lot of valves. Sometimes your patients just don't have great veins. But this is an instance of where it happens, is that sometimes we just struggle a little bit as nurses, and that's totally okay. Admitting that you can get better, or that there are certain areas that you can get better in, are a great opportunity for you to become a better nurse. So here's an example of what happens. So it's not going to work. What we're going to do is we're going to call it and just understand that this is not a great location for this patient. All right, in this scenario, what's going to happen is we're going to place that IV in the forearm, which is a great location. What we're going to do is insertion at a 10 to 20 degree insertion angle. One thing I want to point out here is that we are going to get a little bit of blood on the patient, and that's totally okay. This is why we have gauze in those IV kits. It's really a great feature of them because what it does is it allows us to clean up our patient if there is a mess. We can't expect everything to always be clean and perfect all the time, but what we can do is use the tools that we have available to make our life a little bit easier. So a couple of things I want to point out. So she flushes this IV, and we obviously see that we get some blood returned back. After that's in place, we're going to use a securing device to secure the IV in place. That keeps it from running around. And the other thing too is we'll apply some tape. But there is one important thing that I want to show you that she does here in just 1 second. You can see that there's actually blood in this extension tubing, and she flushes it. She flushes it, and once it's clear, she'll apply that clamp and keep that clamp in place. That keeps blood from flowing back from the patient into the IV and into that extension set and keeps clots from happening. Get it all secured, and then time, date, and initial. And finally, another great location is that AC. The AC is great. Just one thing to remember is that it can occlude because it's always being bent. 10 to 20 degree insertion angle, bang, got it. And then we've got that the blood return. We're going to apply the pressure to try to keep the blood from flowing back. And if we do, then that's great. Again, sometimes we just want to be aware that it can happen, and we want to try to keep that site clean. Apply that extension set, put it on. And then the other thing we're going to do is we're going to flush and just make sure that the IV is patent. Get some blood return, great, and then flush it through, and then we're going to reach up and clamp it. And once it's clamped, then we'll grab that securing device, make sure that it's all good to go. And once you're all set, then just make sure that, again, you're following policy. Then you'll use some tape to tape it down, and then we're going to time, date, and initial our IV site. Now to recap. For patients with dark skin tones, it's not always an easy task to put IVs in these patients just because you can't see the veins. So always go by feel. That should be your first strategy for these patients. Use experience and knowledge and your knowledge of anatomy. That will help you identify locations that you can actually place those IVs. If you need to get a little bit more visualization, you can use the alcohol prep. The alcohol prep's going to allow you to maybe see a vein a little bit better by creating a little bit of contrast with the light. Also, that irritation from actually running that alcohol prep over that vein with the pressure is actually going to cause that vein to distend a little bit, and you can use that. The other trick you can use is a blood pressure cuff, and that's going to help with distension. All right, guys, I hope that these tips and tricks have been helpful for you to get your IVs in those patients with darker skin tones or veins that you can't see all that well. We love you guys. Now go out and be your best selves today, and as always, happy nursing.